Hey, I have a client who listeners. Did you know I have a growing library of NCB-approved 1-hour online self-paced continuing education courses that you can do anytime, anywhere? Well, now you know. Current classes include What's Next? COVID-19 updates for massage therapists and a massage therapist's introduction to pharmacology part 1 and brand new, a massage therapist's introduction to pharmacology part 2. Classes are $20 each, and they confer 1 hour of continuing education credit. Want to know more? Visit my website at ruthwerner.com and check it out. Be sure to sign up for my mailing list so you'll never miss a new class.
Anatomy Trains is thrilled to announce our first ever Women's Health Symposium. This live online event takes place February 26 and 27, 2022, AWST, that's Australian Western Standard Time. Register by January 21st to receive a significant early bird discount and over $400 worth of bonuses. We have invited a powerful lineup of all female authors, physicians, therapists, and clinicians to share their passion and life's work. Visit anatomytrains.com for details.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. For today's episode, I have a special experience of sharing this with my good friend, Pam Fitch. Pam, would you like to introduce yourself and tell us, just maybe give us a couple of your titles?
Massage therapist for many, many years, more than 30, and educator, writer. I do some peer supervision, some consulting.
Well, and Pam's book that I have been using lately for my work is called Talking Body, Listening Hands, A Guide to Professionalism, Communication, and the Therapeutic Relationship. And I will have links to Pam and all of her work and classes in our show notes today. So Pam is going to help me take apart this week's I Have a Client Who story, which comes from a wonderful massage therapist. And I'm not going to give any revealing information this time, not even about where this therapist is located. But here's the story. I have a client who was a mental health provider who came in for her first session. She wanted a full body Swedish massage, and everything was going well until it was time for me to touch her legs. And I noticed that when I touched anything from her foot up to her knee, she was great. But when I moved to her inner thigh, her whole leg just stiffened and came right up off the table. And I said to her, I notice that when I touch you on the inner side of your thigh, your whole body just says, oh no, get away from me. So I just want to check in. Is there an injury? Is there any pain here? And the client said, nope, there's no pain. I don't know what's going on. I have, whatever. The therapist and the client decided together that they would redrape her leg so that the drape came down, almost down to her knee instead of being tucked up high. Mm-hmm. And then they were able to finish the session and things seemed to go pretty well. Later, the next day, this client posted a review of the therapist on Yelp and said, oh my gosh, you have to go see this therapist. She's trauma informed. She's body positive. She's just great. And that client became a regular client for a prolonged time. And the therapist, who had no formal training or even familiarity with the concept of trauma-informed care, was really confused and finally realized that must go back to what she experienced with the client's leg. And there's another piece to this. There's two more pieces to this story. One is after the session was over, the client revealed to the therapist that she had been raped and had thought that she really had been finished with all of her processing and all of the sort of, the dealing with this trauma that she had to do. And clearly being touched on the inner part of her thigh showed her that there was, that there was more going on. And it also, another part of this is that the therapist who was conducting this session, while she had no formal training in trauma-informed care, was herself a survivor of many years of domestic violence and had done some training to work with domestic violence survivors and had decided that was hitting too close to home and she really wasn't ready for that yet. But, my sense, Pam, is that history and background gave her a sort of spidey sense, a sort of extra sensitivity to what was happening for this client. But I thought, since you are a real go-to expert on the therapeutic relationship and clients who have complicated histories with touch, that I would love for you to kind of talk about what you respond to in that story.
What a great story. This is just an amazing example of the intuitive nature of massage therapy. And we have built into our therapeutic DNA, if you will, the concept of consent, and that when we try to touch people in ways that they don't want to be touched, it feels wrong. Absolutely, gut perspective is, I can't go there. So if a client is reacting in such a way that their whole body stiffens, there's a story there that I don't know about. And in this case, you're describing the client not knowing anything about that story. She may have known her personal experience with the sexual assault, but she didn't connect it to her upper leg. So this is an example of how our body keeps score. Dr. Bessel van der Kolk, who's an expert in trauma, wrote a wonderful book called The Body Keeps Score, and he describes how our experiences of trauma become encoded in our bodies. And if we keep revisiting the trauma, we create these pathways, neural pathways, that reinforce the trauma. By not insisting on touching the upper leg, this therapist did exactly the right thing according to the science and according to the trauma literature, because the client wasn't comfortable receiving the touch, and the therapist just simply said, let's redrape and let's do the work where you can stay present. And that fundamentally for me is like one of the best ways to do trauma-informed care. People need to be massaged. We have a need for touch. As human beings, we're wired for pleasure. We're wired for touch. But if touch doesn't feel right, then massage therapy may be premature. So it's really, really essential that we go slowly and we only touch the parts of a client's body where they can accept comfortably what we're doing. And what that does is reinforce the positive. It doesn't reinforce the negative, the traumatic signal. I guess that's what's coming up for me.
Well, and clearly this therapist, through her sensitivity and her great ability to communicate clearly what she's observing, created a sense of safety for this client that person was able to come back multiple times and be really happy with the care she was receiving.
Yeah. But I also find it interesting that the therapist had not heard the word trauma-informed care. Many of us have heard it many times in the last couple of years,
right?
Because as you were saying earlier, it is a little bit of a buzzword, certainly in the therapeutic community. But really, when you unpack those three words, everything that we do should be accomplished with informed consent, where we're explaining what we're doing, how we're going to do it, what part of the body is going to be touched, and we give people the opportunity to say no. Okay, so that informed consent approach is fundamentally parallel trauma-informed care. That's
and
it.
It's something we do with everybody, or at least
we should do.
We should be doing with everybody.
Yes, it's like a fundamental. It's not the only aspect of trauma-informed care, but it is probably the how-to, the go-to. You never touch anything that people aren't prepared to, where they're prepared to receive touch. The other piece of trauma-informed care that I think is really important is the first two words, hyphenated, trauma-informed. And that means that we have a responsibility to inform ourselves about the impact of trauma on our clients, on our human body, generationally, societally. We have a responsibility. If we're going to touch people, and touch is our modality, we have a responsibility to actually inform ourselves what the impacts are of touch, not just the positive that make us feel good, but also what is the capacity of our touch to harm people. Mm-hmm. And we really need to be supportive and clear about that part.
Yeah, I agree. It would be hard for me to agree with you any more than I do. So, well, I want to thank you so much for being with me, Pam, to help unpack this a little bit. It's a huge topic, but I just, hearing stories like this make me really proud to be in this profession, because I think as a therapist did such a beautiful job.
Yeah. Without even realizing it, massage therapists have the capacity to do so much good work with clients. And as long as we inform ourselves about what our boundaries are, this is pretty powerful work. Thanks.
Yes, it is indeed. Thank you. Before we wrap up, I'd like to share a little bonus. I have a client whose story. This comes from the early days of Pam's life as a massage therapist. Her encounter with this client had a profound impact on the rest of her career.
Ruth, I'm going to tell you a story about the first time I encountered a client in my practice who exhibited signs of real complex trauma, PTSD. Believe it or not, it was 3 weeks into after I had opened my practice, and I was working in a small treatment room in a doctor's office. The doctor had referred me this client because she thought that perhaps massage therapy could help. So on this day, the client arrived. She was a formidable woman, a big voice, a big personality. And she sat down on my little tiny client piano stool that I had. And she announced that I've been sexually abused most of my childhood. I'm just recovering for alcoholism. I'm cross-addicted to pills and have a bit of a problem with food, as you can see. Can't stand to be touched, and I want a massage. You could have blown me over with a feather when I looked at her, because I wasn't quite sure how to respond. Nothing in my training had really prepared me for what this client was requesting of me. When you think about massage, the term massage therapy, massage is all about putting our hands on people and comforting and soothing them. But massage therapy is a very distinct kind of agreement between a client and a therapist, where we will protect that client from harm, and we will put their best interests first. And I had no training in how to do that with this individual. Intuitively, I knew that touch was perhaps important to her, but a real minefield for her, considering what she had gone through in her life. So, keeping my face very, very blank almost, I said politely, how would you propose that we do that? Because honestly, I didn't know how I was going to approach her situation. And she thought for a moment, and then she said, well, I think I could let you massage this part of my hand. And she was pointing to the hypothenar eminence on her left hand. That was probably the only place on her body where she felt she could control her reactions to touch. Not knowing what else to do, that's what we proceeded to do. I got some pillows, put them on my knees, covered that with a sheet, and she gave me her hand and laid it on those pillows and the sheet as if it was on top of a table. And for about 10 minutes, I massaged the hypothenar eminence of her left hand. At one point, she finally said, "Okay, that's enough. I need a cigarette." And she left. But that client established for herself a goal of receiving a full body massage because she sensed that she needed to get over that concern with being touched. So she would come in every 2 or 3 weeks for a massage, and each session we'd do a little bit more. We'd go to the wrist and then up to the elbow and then maybe the other hand. And gradually over 18 months, she got herself to the point where she could stand, where she could tolerate, maybe even feel good during part of a session, where she could receive a full body treatment. Now, she could never tolerate me working on her abdomen or her upper inner thighs, but she basically received a full body massage as most clients receive it. At the end of the 18 months, she said, "Okay, I think I'm done." And she stopped the treatments. This client became my biggest teacher. I learned from her what it meant to hold herself in the face of very scary circumstances, but still choose to receive touch. And choice is a big issue for people who have been traumatized, because when they are traumatized, choice of what happens to them is taken away. So by her coming into the treatment room, she could make a choice. It's this part of my body, it's for this many minutes, and I get to say what happens and for how long. So that level of choice, that really taught me the importance of choice. It also taught me the importance of consent, because as long as she knew what I was going to do next, she could manage her own feelings, self-regulate. And then when she felt like she had done all she could, she stopped. And I realized that there comes a time in every treatment series where there's an end, and that treatment doesn't go on forever, and it's a really healthy thing for there to be a beginning, a middle, and end.
On behalf of Pam and myself and every caring massage therapist, I want to say thank you to all of the people who are willing to take the risk of opening themselves to the possibilities of healthy touch. You are all remarkable. Hey, everybody. Thanks for listening to I Have a Client Who Pathology Conversations with Ruth Werner. Remember, you can send me your I Have a Client Who stories to ihaveaclientwho@abmp.com. That's I Have a Client Who, all one word, all lowercase, @abmp.com. I can't wait to see what you send me, and I'll see you next time.